In this chapter of the Pathways Guidebook, we're going to cover a most important segment. It's called communication. You know, times are going to be a little challenging for you with your circumstances, the condition of your loved one. And within the diseases of dementia and Alzheimer's, one of the most critical aspects that becomes readily apparent is repetition, short-term memory loss, and so forth. I want to help you understand what's going on with your loved one and then how best to react to it and interact with that. That'll make all the difference in the world in the response and temperament of your loved one, and in time it's also going to do wonders for you. It's real important that you learn these techniques so that you can stay grounded and paced and as pressure-free as possible. Notice I'm smiling when I say a lot of this because I know it's easier said than done. However, everybody comes to terms with their circumstances at their own pace. I'm going to share a few ideas with you that worked for me. Maybe you can adapt some of those or adopt some of those. Read a lot of the books that I recommend. You'll get some other ideas as well. And I'm going to talk about some of those books as we go forward. In this chapter, I've given you pages of tips on how to understand what's going on with communication. And I want to tell you that rational thinking no longer lives there. That might seem really obvious to you, but there will definitely be times when you'll think, why are they asking me that question? Don't they remember what I just said? How can they even ask me that? It doesn't make any sense. That's right. It doesn't make any sense because their whole mental capability has been impaired. It's been compromised. So when you get ready to be exasperated, if you could just take a deep breath first and remind yourself, if they could, they would. They're not doing this to frustrate you, believe me. It's even more frustrating for them that they ask the same thing over and over and don't remember the answer, or that they can't grasp what it is you're asking them. Very, very frustrating. So I'm going to cover just a few of those tips right now. I'm going to invite you to go through them one by one on your own. But for example, speak slowly. When you're talking to someone with Alzheimer's or a dementia, they cannot process as quickly as they could prior to this disease. You know, we're sort of rapid speak, rapid think, instant gratification, want it quickly, want it now. They don't have that capability any longer. So speaking slowly, speaking clearly, looking at them when you speak to them, get their eyes to focus on your eyes, very important. They will actually be able to process more effectively by looking directly at you, just as I am right now, speaking softly, calmly, slowly. Very helpful. Let me give you an analogy. When you had young children, or whenever you've been around young children, you find that you speak more slowly, you enunciate, you use your hand gestures, and you look at them to see if they're registering a response to what you're saying. You're dealing with a young child now. They may not look like a young child, but mentally, that's where they're going. They're shifting. They've gone from being an 80-year-old, a 60-year-old, perhaps. They are now a 7-year-old, a 5-year-old, a 3-year-old. And in time, you'll be able to test out your own understanding of what age level they're at. The point of telling you this is remember how you spoke with a child and apply that same premise and practice with your loved one. Please don't use baby talk. That might have worked when they were 3 years old. That is very demeaning to your loved one. They still maintain their dignity. They are, on every other level, a very mature person. They just can't comprehend as effectively as they used to. And when you speak to them in baby talk language, what would my little honey like? That's really an affront to them. It's not cute. In this case, you've really injured their dignity, and that's the last thing you want to do. Another tip I'd like to emphasize is when they're talking with you and it's taking a long time for them to get their thoughts together, do everything you can to be patient. Try really hard not to interrupt them, and try not to criticize or argue with them. Remember, they don't have a sense of logic and reason any longer. Whatever they say, go along with it. If it doesn't make sense, act as if it does make sense, and do what needs to be done. That's what's real important. What you will find in short order is that if you try to correct their statement or their understanding of something, it'll upset them, it'll agitate them, they'll get frustrated. When you're with somebody that's agitated and frustrated, it agitates and frustrates you in response. So you're going to be playing off each other's emotions. Remember, you're the grown-up in this situation, and I use that advisedly. You are the grown-up. You need to stay calm. You need to stay in control of your emotions. Just go with the flow. Let it be. Do whatever has to be done. If you're asking them to get up and go with you and follow up on something and they're not responding, just let it go. Just be calm. I can't emphasize that enough. A lot of tips in here that I'm going to encourage you to take your time to read over and over again, because I actually made a point of going through and explaining so many of these elements. What is living in the present? When I speak slowly and I look at them in the eyes, what exactly is that supposed to accomplish? How do I respond without being emotional? Okay. And how do I cope with the fact that they've repeated the same question umpteen times and I think I'm going to lose my mind myself if I have to hear it again? Well, we all have our own process. I can remember specifically the moment when caring for my mother, I thought, if she asks me that question again, I think I'll lose my mind. How am I going to handle this? I'm just at the beginning of this. I'm going to be enduring this for a long time. At that moment, I was really gifted with the idea of just thinking of these words coming through like the wind going through the trees and just rustling the leaves. And I decided that's what I would do. I would hear these words and they would just go through, but they would not attach to me. I would just hear what she said and I would respond, but I wouldn't let it emotionally attach. Within this chapter, I've also got a couple of pages that I invite you to make a lot of copies of. Put them on your refrigerator, give them to your family and friends. It'll help them interact with your loved one effectively. Caring and kind communication tips. The do's, the don'ts, and the remembers. And also, I've given you some examples of how to handle situations. For example, why you don't want a reason. Here's a scenario. The loved one says, what doctor's appointment? There's nothing wrong with me. I don't need to go to the doctor's. Here's the old you. You've been seeing this doctor every 3 months for the last 2 years. It's written on the calendar. I told you about it yesterday morning. Not going to cut it, folks. Here's what you want to say. Oh, it's just a regular checkup. Nothing to be concerned about. Oh, I'm sorry. Did I forget to tell you? Now, you've just completely changed the whole dynamics of the situation. You've taken all the anxiety away from your loved one. And you've redirected them. Oh, it's my fault. Oops, I goofed. Gee, nothing wrong. Sweetheart, don't be concerned. And you're doing that with a smile, all right? Because if you smile, they'll relax. I've got a whole page here of some suggestions, and I invite you to create your own little examples that you can become familiar with. You just want these things to roll off the tip of your tongue in a natural sequence. In the communications chapter, I really think you're going to learn a great deal that will be very beneficial to you and help you for a very long time. At the same time, I'd like to invite you to feel free to reach out to me if I can be of any help to you personally. Go to our website, www.dementiahelpcenter.com, and just click on the picture, my picture, and also the link that says one-to-one. You'll find my direct email address and my phone number. Don't hesitate to call.